Hello, I'm Chanae, Coach Chanae from Academic Coaching for World Changers. I am here today to do a video for you all around biopsychosocial. Before we get started talking about biopsychosocials, I just wanted to remind you all that you can find us on academiccoachingforworldchangers.com, where you can find information there on our services that we offer, our classes, our groups, all the resources that you need to help prepare you to pass your test. You can also find similar videos to mine on YouTube, where you can see different video content. And while you're there, remember to like and subscribe. If you're interested in services with me, booking a session with me, you can find me at Coach Chanae at acwc@gmail.com. Before we get started talking about psychosocials, I just want to remind you of how Dr. Pam teaches us about learning. We use the resource of Bloom's taxonomy here, where it really shows the pyramid of how we learn. The bottom layer of that pyramid speaks to really remembering the information, recalling facts and basic concepts. We really should be able to know that we're learning by the information we're able to recall. And when you recall it, you should be able to recite that information. You should be able to speak to what it is that you are learning. And we recommend you study at least 4 hours a day, 2 hours in the morning, 2 hours in the evening. And when you do that, focus on one topic at a time so that that will help you to remember. And once you can begin recalling it, and understanding it, describing it, explaining the information, you know that you are learning it. You then begin to apply the information, using it in new situations. You analyze it, where you compare it to different theories and theorists, and then you begin to evaluate it. You judge it, you critique it, see what makes sense for you, what doesn't seem sensible. How can you remember this information? You begin to evaluate it, and then you create it, and you make it your own. You create it and make an original work. You begin to construct it, develop it, and investigate it more. That's Bloom's taxonomy on how we learn. Remember, this is just a reading test. All of the information that you will get in each question is the information to answer it will be in your test question. It is a reading test. They're not going to ask you to think about what you learned in your practice, what your boss is telling you. The information is going to be in your vignette. The information to answer the question will be in there for you. It's a reading test. So we'll start with this one question here today. A social worker is completing an intake with a 40-year-old client who reports frequent migraines and recent memory loss lapses. Which area of the biopsychosocial assessment should the social worker explore first? Trauma history, current medications and medical history, or coping strategies for stress? So, what we have to remember first off in answering the question is that it is important to think about, what is this question asking me? So, understanding that we're doing an intake with a 40-year-old client who's reporting frequent migraines and recent memory loss, we think back to the biopsychosocial process and those steps. And so, we're going to think about that assessment and think about, what do we explore first? So, as I was saying, we know we're using our knowledge of biopsychosocials, and it's important to think about what's first. Everything that they're giving us may be valid. We're going to go through each one of these steps in the biopsychosocial assessment. But what is the first order of what should be done first? What is our first step? So we think about that. We think about the biopsychosocial. And at first, before I get into that, you want to make sure we read each selection, each option. Are we going over trauma history first? Is that the first step you want to take? Or are we thinking about medications and medical history and coping strategies for stress? Those are our three options. And with those options, we have to, again, recall our information and think about the steps to a biopsychosocial, and we think about what should be done first. So, what we know about a biopsychosocial is that assessment is a comprehensive evaluation, and there's different steps to completing this. The first step when your client comes in is you really want to explain yourself. You want to explain who you are, what your role is. You go over confidentiality with the client and explain the steps to your therapeutic process. After that, you want to speak to your client about why are you here? Why are you here now? What has brought you in for services? And talk about what the presenting problem is. From there, in the biocycle, we then begin to talk about the biological section of the assessment for the client. We think about their health and their history. We think about medications, how they're sleeping, any medical issues that may be occurring, family history. We think about emotions. The second step is the psychological. When you think about psych, you think about this interplay, the mental health aspect of it, the emotions of the client. What is their mood? How are they coping? What is happening around their psyche? And then the last part is the social, family relationships. Who do you identify as your supports? Those are the framework of the biopsychosocial assessment. And then you would end on some strengths. Actually, you want to talk about what is going well for you. What supports do you have? What coping skills do you use? And you would finally end with a treatment plan. You and your client would discuss treatment planning together, where you would think about what are our next steps? What are our goals going to be? And all of these aspects of the biopsychosocial, they're individual aspects, but they also play together. The interplay of the biological, psychological, and social factors, they all combine together, influence the person's overall functioning and health. So, as I was mentioning earlier in the last slide, there are the different components that speak to the biopsychosocial assessment. The biological, which speaks to any medical issues, disabilities, any genetic vulnerabilities, substance use, drug effects. We want to think about that. What is happening inside the body? What is happening in the brain, the chemistry, hormones. That's the biological. And we would start with that. We want to understand who you are. How is your health? How are things impacting your biological aspect of your body? And then from there, we move on to the psychological aspect of this client. We want to talk about their thoughts, their stressors, their beliefs, what makes the psychological aspect of your client work for you? What are your family relationships? Is there any trauma, any self-esteem issues that we need to know? You want to know the psyche, the psychological functioning of your client. And the last circle speaks to the social aspect. Who are their peers? Who are their social supports? What education do they have? What has their surroundings been like? What makes you you? What is the social aspect of your life and your functioning? Your culture, your community, how do you function socially? All three of these categories really speak to uh, who you are, and in order to heal and to work on the inner parts of yourself, those three components are really connected. Again, they're each separate but connected. One can impact the other, and in order to fully understand or have a good assessment on who you're working with, the biopsychosocial is a very crucial part of your assessment. It involves the mind, body, and relationships. So back to our question. A social worker is completing the intake with a 40-year-old client who reports frequent migraines and recent memory lapses. Which area of the biopsychosocial assessment should we explore first? So we think about, what do we rule out? We rule out one that is like, no way, this is not an option. And the first part of understanding your client, from what we just discussed, would be trauma. That is not going to be the first part of your biocycle. You think about you're in an intake session with your client, and after you explaining yourself and your role and understanding why they are here, you think in real time, is that your first question? Is that the first thing you're going to inquire about is trauma? Probably not. Actually, we would not, not probably. So we would rule out trauma history first. Second set of rule out would be the coping strategies for stress. That is something we're going to get into that, but is that your first uh, step to completing your biopsychosocial, is to say to your client, well, thanks for coming. I'm glad you're here. Talk to me about how you're coping. That's not how you're going to begin. You really want to start off with understanding the biological part of your client. Who what is happening inside of you? Any illnesses, any medications, any hormonal issues? You want to understand the biological aspect of your client first, which leads us to current medications and medical history. So it's important, essential to rule out medical explanations for a client's symptoms. In this case, our client is presenting with several medical, biological symptoms that could indicate a medical condition. So the first step is exploring the client's medical history, including what the medications they are taking. The information is in the question. So I hope my explanation around biopsychosocial was a little helpful to you in understanding that process a little better. Again, as I said earlier, please remember to check us out on YouTube, where there's more videos with similar content as this, and like and subscribe while you're there. You can also find us at academiccoachingforworldchangers.com. Thank you.